Hello, my name is Ariel Carter. This is my head to toe assessment. This is my participant, Tony Rush. Hello, how are you?
I'm doing so.
Okay, so we're going to start with just head to toe, starting with your hands and nose. Hands are clean, warm and dry, groomed. Cuticles are nice and intact. Capillary refill, less than 3 seconds. There's no lesions, no calluses. Both hands are good. Then we're going to do your hair and your head assessment. Hair is fine. Scalp is okay. You just want to feel around. Make sure there's no lumps, no lesions present. Hair is distributed all around. There's no bald spots. Noted. Then we want to test your temporal artery. Both sides. You should feel a pulsation on both. Okay, great. And then we're going to test your mandible reflex. So what I'm going to actually do is just bite down really tight, like clench your teeth. And then I want you to, like you're chewing. Okay, that's fine. Good. Then we're going to examine your eyes. We're going to test your field. So what I'm going to do is both eyes. I want you to cover one eye with your hand. And then I want you to follow the other eye. So straight, please. Follow the other eye with my hand. Here. Up. Down. Great. I'm going to do the other eye now. Same way. Cover your eye. Follow my hand. And this test the muscle movement and all fields. And I'm going to actually follow my hand. And you're just going to check for constriction and dilation. And you're going to go to the other one more time. Great. Then you're just going to assess the ears, both ears. Look at me. There's the metrical. The oracles are great. No lesions, no lumps noted. You want to look inside the external ear canal. Make sure that there isn't any wax buildup. Appears to be clean. That side. Then you want to just hold the pinna. Then you go backing up. Just examine the inside of the ear. That's fine. I'm going to do the same here. You go get the pinna, go up and back. Great. And then we're just going to do the auditory test, and you're just going to whisper something in your ear, and you're just going to repeat it back to me. And this is just a test to see if you can hear well.
Neurological assessment.
And then I'm going to go to this ear.
Head to toe assessment.
Okay, great. Then we're going to go down to the nose. The nose, make sure that it's midline with the face. Make sure that the septum is not deviated and straight. And then I'm just going to actually hold up for me. You want to make sure that both nasal passages are clear of any foreign object. We can also now do the smell test. I'm just going to hold one. Just going to lift this perfume here. Maybe you smell that?
Mm-hmm.
Okay, one time here.
Yes.
Okay, great. Then we're going to do your mouth and throat assessment. Right. So first you're just going to start with the lips. Make sure the lips are symmetrical. Make sure there's not any lesions or bumps around the orifice of the mouth. And I want you to open up for me. Alright, and just going to check the teeth. Make sure all teeth are there. Has a retainer. Previous braces was there before. You want to ask the patient to open up, please. I'm going to look in the back of the throat. Stick your tongue out. Make sure that there isn't any swelling or redness in the back. Then also want to test here to make sure if you feel any lips that have been swollen, that may be indicative of any infection. No swelling indicated. Can you swallow for me? One more time. Great. And then I want you to lift your tongue up for me. And you go move it from side to side. Great. Then I want you to swallow one more time. Okay, then I want you to open up and I want you to say ah. And this is your checking for the uvula. Make your tongue out a little bit. Okay, great. Alright, then you're going to expect the neck. You sit up straight for me. Make sure that the neck is midline of the body, is proportional to the chest and the head. And you also want to make sure you palpate for the cervical node. Make sure that there is no tenderness, no inflammation, because that may be indicative of an infection as well. Usually ear infection. Then you want to look down. You can't really palpate the trachea, but if you swallow, you put your two hands here, swallow for me. Sometimes you can feel the movement of it. One more time. Then you want to palpate the thyroid gland. Make sure there is no swelling on both sides. Can you swallow for me one more time? One more time. Thank you. No swelling there. Now we're gonna go to the back. I need you to just turn around towards the window for me. Okay, great. And then this, you're just going to look at the back, make sure that there isn't any lesions or any moles that look abnormal. And then what I want you to do is take an inhale and then exhale. One more time. And what you're doing here is just inspecting the back, make sure there's symmetry when you inhale and exhale, make sure that one side of the back is not raising farther than the next. Both is symmetrical with inhalation and exhalation. Then we're going to test for tactile furnaces. So what I want you to do is just say like 99.
99. 99.
One more time.
99.
And you should actually feel vibrations, what you do in the back. One more time.
99.
Yes, you feel vibrations there. Then we're going to go to the front of the, and turn back to the front, thank you. And then we're going to do the same here. I want you to say 99 with the tactile furniture.
99.
One more time.
99. 99.
Okay. And then we want to also take breath starts. Let's breathe in and breathe out for me. Deep breath in. Deep breath in. Deep breath in. Then I'm going to go to the back and do the same thing. Deep breath in. Deep breath in. Deep breath in. Okay. And I just want you to say normal. And this is just counting respirations and also looking at the chest to make sure everything is symmetric with inhalation and exhalation. So right now he's breathing around 16 breaths per minute. Okay, now we're going to test your upper extremities. I want you to put both arms out. Okay, in front. Can you turn them up? Supination, pronation, bring them out. Can you turn them in a circle forward, backwards? Can you push them down? Down. Okay. How about up? Great. Okay. And then your epitracheal node here. You want to make sure that it's not enlarged. Palpate it here, and one more. Right here. Alright, great. Now we're going to go to your breath. Breath are firm, symmetrical, areolas are present. There is no drainage or discharge coming from the nipples. God bless you. Alright, now we're going to go to the heart. Going to auscultate the heart. About 72 breaths per minute, or 72 heartbeats per minute, and then we're going to do all heart sounds. I'll start with the aortic. Pulmonic. Erb's point. Tricuspid. And mitral. Alright. And then we're going to listen for S1 and S2. And when you listen to these, you just want to make sure that there is no heart murmurs or extra heart sounds. So S1 is heard more here. Apex of the heart. Locked up is what you should hear. And S2 is heard more here. Okay, great. And we're just going to test your radial ulnar pulses. Both bilateral. See this one. Radial pulses here. Both are present. Nice strong pulses. Radial ulnar pulses. Okay. And then you do your Allen's test, which is your holding them both radial and ulnar pulse. And you release the ulnar, and you should see immediate blood return. Great. So we're going to go to the neck and we're going to inspect your jugular vein. There's no distension. Jugular veins are here. Usually in people with congestive heart failure, you see a lot of distension, but there is no distension here. Can you just sit up? Yeah, exactly. No distension on each side. Great. So now I'm going to have you do is just lay down. You can actually just lay across here. We're going to go to the abdomen. Okay, so for the abdomen, we're just going to auscultate all bowel sounds first. You want to inspect the abdomen. Make sure that there is no distension. Make sure that there is not a lot of rippling. You want to also, you can assess the nutrition status. You see a lot of the rib cage or a lot of bones in there. That can be indicative of malnutrition. Patient seems and appears to be healthy. So now we're just going to auscultate each quadrant. Patient bowel sounds are hyperactive, I'm assuming, because did you eat this morning?
No.
So they do appear to be hyperactive, which is fine. But then we're just going to palpate. Any pain?
No.
And here you want to just assess for any enlarged organs, like the liver, pancreas. No enlargement. Palpate it. Okay. Then we're going to inspect your lower legs here. We're going to go this way. Just inspect the legs. If you see any varicose veins, any swelling, any warmth in the back of the calves, which could be indicative of DVTs of some sort. Patient legs are actually fine. No swelling, no edema noted, especially in the ankle part. Popliteal pulse. It's palpable. Go down here. Dorsalis pediis pulse. Sometimes these are a little bit harder to. Then the posterior tibia. All right, great. Any tenderness in your calves?
No.
Okay, can you sit up for me? All right, can you turn your whole, like, just turn your torso? And this is just testing the hips. Okay, can you turn the other way? Great. And that's just abduction and abduction. Then we're going to, can you, for your feet, can you turn them in? Up. Turn them in and up. Okay, and then turn them out. All right, great. All right, now we're going to do sensation neurological. I'm just going to take a piece of paper towel and just go around your face. Close your eyes for me. Put your hand out and tell me when you feel anything on your face. Now I'm going to ask you to keep your eyes closed, and I want you to keep your eyes closed. And I'm going to put this in your hand, and then you tell me what you think it is. What does it feel like?
Rock.
Okay, great. Alright, then I'm just going to ask you to keep your eyes closed, put your finger out in front, touch your nose, do that with the other hand. Touch your nose. Great. Okay, so you can take it off now. And I'm going to ask you to stand up. I want you to bend down, touch your toes. And right here. Here, you want to look for a spine. Make sure the spine is in alignment. You want to make sure that, okay, stand up. Then I want you to touch your knees. Alright, great. And then I just want you to stand, put your feet together. And this is just want to check the balance. Oh, you can't really see it. But that's alright. Stand back some more. Okay, put your feet together, hands to the side. You just test and balance to see if coordination is together. Some people have problems with equilibrium, but there doesn't seem to be any issues with him. Okay, then we're going to go to, I want you to sit back down. Then just want to test your reflexes. I'll go here. Just going to use the bill of my stethoscope and she'll feel flexion. With each. And go here. I'll go down to your knees. Same way, just relax. I use my stethoscope. Okay. Those were your reflexes of your tongue, the biceps, and the triceps. Do the walking. And that's it. Thank you so much. That's been my head to toe physical assessment. It's been a great semester. Thank you.